Hello, my name is Pellise, and in this video I'm going to present a quick overview of what my bachelor thesis is about. So for now the title is Computational Model of the Fetal Heart with Aortic Coarctation. Okay, so first of all I will start by presenting a little bit the background context of my TFG. Within the different congenital heart diseases that doctors have to deal with, my bachelor thesis is focused on aortic coarctation. In a few words, this disease is characterized by a narrowing that occurs in a portion of the aortic arch, most commonly affecting the aortic isthmus, which is adjacent to where the ductus arteriosus attaches. This last one is a key component of the fetal circulation and, above all, a key element for the fetuses with aortic coarctation. Indeed, it acts as a compensatory mechanism to cope with the narrowing of the aorta, as it allows blood to bypass the defect and provide oxygenated blood to the lower body. The presence of this extra vessel is a characteristic of the fetal cardiovascular system. They are called shunts, and there are more than one. Regarding AOC again, the problem is that after birth, when this ductus arteriosus closes, hemodynamic consequences occur, as no more bypassing of the aortic coarctation can take place, and this can lead to severe cases that can vary from mild systemic hypertension to serious heart failure and even death. This is why there is a clear need to have better prenatal diagnosis of this disease so that doctors can have planned deliveries and act on time. However, this is nowadays still not possible. Even if technology has improved a lot, the narrowing of the aorta is usually difficult to observe in the echocardiogram, and no restriction of blood can be seen either thanks to the presence of the ductus. This is why a more evident sign of alert for doctors is ventricular disproportion. Indeed, due to the adaptation mechanism with the ductus, the right ventricle becomes responsible for providing most of the lower body flow, which makes right dominance emerge, as you can see here in the photos of the video. However, this is a cause of a lot of false positive, as right dominance is also very common during the third trimester of healthy fetuses. So this is why it is not a useful symptom to take into account. All in all, coarctation does not have specific or easily identifiable symptoms, and this is why there is a clear need to provide tools that enable finer prenatal diagnostic accuracy. Responding to this need, computational models are emerging, enabling the creation of realistic simulations, which are contributing to better understanding of diseases. As you can imagine, my bachelor thesis has a similar purpose, but focused specifically on aortic coarctation. Indeed, the overall objective of my thesis is the development in MATLAB of a closed lumped model of the fetal cardiovascular system to improve the understanding of AOC. For you to have a brief insight, a lumped model is based on the idea that the flow in a tube is comparable to the current in an electrical circuit. So to achieve my goal, I am taking as reference two different studies made by Giancarlo Penati and Patricia García Cañadilla. And for now I have divided my work in two sub-goals that are, first of all, improve Penati's lump circuit by modifying it into a more detailed one, and then simulate patient-specific hemodynamic changes in the fetal circulation caused by different cases of aortic coarctation. And that's it. Thank you very much, and I hope you like it.